the group and I were having a discussion over what I would call a business issue, contractual issue, and I went and got some input from the medical staff, medical staff leadership, that they should have a relationship or interact with. And the medical staff made it very clear that, Craig, if they didn't want to play ball or negotiate or work with you, it was okay to let them go, find another group, because, well, all they do is read films.
There's a perception that all radiologists do is just interpret films, and it's very hard for other specialties and administrators to see what exactly the value is that we bring as far as with these changing paradigms of healthcare. Previously, the success was defined by how many exams one could do in a particular period of time, so it was purely based on volume. However, with trends in reimbursement, there was no emphasis to the degree that there is now on quality, service, and other items that are important now, especially since cost reduction in healthcare is going to be important. So then the question becomes is, where do you draw the line between not doing too much care and not doing enough care?
Historically, I've always said, a radiologist would typically hide behind a contract and say, we have a contract and we're great at what we do. But over time, again, a lot of other physicians tend to get into those same arenas, and so at some point you've got to demonstrate your quality. You've got to demonstrate the value you bring to patient care and to an organization.
So the matrix was designed to partly quantify and also to determine, well, what exactly is it that we do other than just reading film? So everything on the matrix is activities in the field of imaging that have nothing to do with interpretation of the film, but that has everything to do with all the activities that lead up to imaging, during imaging, and after imaging in a presentable, quantifiable format that's easy to understand for administrators, other clinicians, to see the true value that we bring in healthcare.
When you get everybody buying into the concept of the value-added program, it gets very very impressive, the amount of work that's performed by the collective. And we've been able to quantify these, and it gets in the thousands of hours. And we can show what different group members are doing, perhaps the ones that are doing administrator type of work, or they're doing more QA work, or doing more value-added work. Those are going to be reflected in those matrices.
Beginning to really build a program around that, metrics around that, and then a way of communicating it and valuing it, actually putting a number or a statistic or something on it that kind of measures that, I think is very important. And so Rad Inc. and Dr. Patel began this process of, okay, how do we do this? How are we going to value all these other things we do?
So the matrix has two key components. There's the input side and the output side. So the input side is where we record the amount of time that radiologists spend on different activities. We incorporate the time that's spent on group activities. So that's on the input side. On the output side, at the end of every year, we take a look at all the activities that were performed, and we summarize it into an executive summary that we present to the hospital in each of the four major categories, under the categories of quality, service, utilization management, and professional development.
So I find that as a chairman in the department, the value-added matrix and the quantification of the value add from the radiology department is most valuable in engaging all of our radiologists. You can always go to the guy that's going to say yes to every project you assign him, but can you engage everyone? Can you demonstrate that you've got a pretty deep bench within your radiology department? And when you do, and when you challenge those radiologists to be engaged at what they can contribute, you've got it. You've got quantification of it, and then you can take it to your administrators in the hospital and show them, look, we've got A through Z covered here.
And they've done a great job so far of putting that together in a programmatic approach, metrics, very defined, measured in terms of time, in terms of output, and kind of providing a scorecard. And they've communicated that to our leadership, our medical staff leadership, and our board. And it's been received really well, because I think it kind of fills in or puts some meat on the bone of all the other things that they do.
And while I could typically have said in the past, it's part of the contract, it's part of an expectation, This way I can actually track how much time they're actually spending, which of their associates within the group are part of this process. Before, I would sit and have to ask the director of the department to tell me, are they there, are they not there, are they doing things or not, and this way I can actually get a quantifiable report that tells me everything they're doing, some of which is probably just part of the contract, but yet they still spend a lot of time in numerous meetings and sessions. So for me, that's the value of this.